Welcome to this video on the role of fermented foods in managing diabetes. Diabetes is a chronic condition that affects millions of people worldwide, and managing it requires a careful balance of diet, exercise, and medication. One approach that has gained increasing attention in recent years is the consumption of fermented foods. Fermented foods are a rich source of beneficial bacteria that can help to improve gut health, reduce inflammation, and lower the risk of complications associated with diabetes. In this video, we will explore 6 key ways in which fermented foods can play a crucial role in managing diabetes. We will look at the evidence supporting the use of fermented foods for improving blood sugar control, increasing insulin sensitivity, reducing the risk of obesity, improving gut health, reducing inflammation, and lowering cholesterol levels. Whether you are someone living with diabetes or are interested in exploring the benefits of fermented foods, this video will provide valuable insights into how these foods can play a vital role in promoting better health and well-being. So sit back, relax, and let's dive into the world of fermented foods and diabetes management. 1. Improved blood sugar control. To expand on this point, consuming fermented foods has been found to have a positive impact on blood sugar control in people with diabetes. The fermentation process involved in making these foods breaks down the carbohydrates and sugars present in them, which can make them easier to digest and absorb. This leads to a slower and more gradual release of glucose into the bloodstream, reducing the risk of spikes in blood sugar levels. In addition, the fermentation process also produces beneficial compounds such as organic acids, which can further improve blood sugar control by enhancing insulin sensitivity and reducing insulin resistance. Organic acids such as acetic acid, lactic acid, and propionic acid have been found to have hypoglycemic effects, which means they can help to lower blood sugar levels. These organic acids can also stimulate the secretion of insulin, which can help to regulate blood sugar levels. Furthermore, fermented foods can also help to reduce the glycemic load of a meal. The glycemic load is a measure of how much a food raises blood sugar levels, and consuming foods with a lower glycemic load can help to improve blood sugar control in people with diabetes. Fermented foods such as kimchi, sauerkraut, and kefir have been found to have a lower glycemic load than their non-fermented counterparts, making them a healthier option for people with diabetes. Overall, consuming fermented foods can be a beneficial dietary strategy for improving blood sugar control in people with diabetes. However, it is important to note that fermented foods should not replace other aspects of diabetes management, such as medication and regular exercise. If you have diabetes, it is always best to consult with a healthcare professional before making any significant changes to your diet or diabetes management plan. 2. Increased insulin sensitivity. In addition to improving blood sugar control, fermented foods have also been found to improve insulin sensitivity in people with diabetes. Insulin sensitivity is the ability of the body to respond to insulin and use glucose for energy. Insulin is a hormone produced by the pancreas that helps to regulate blood sugar levels by allowing cells to take up glucose from the bloodstream. Research has shown that consuming fermented foods can help to increase insulin sensitivity, which can lead to better blood sugar control and a reduced risk of complications associated with diabetes. This is because fermented foods contain beneficial compounds such as probiotics, which can help to reduce inflammation in the body and improve gut health. Studies have found that probiotics can help to reduce insulin resistance, which is a condition in which the body's cells become less responsive to insulin. Insulin resistance can lead to high blood sugar levels and an increased risk of developing diabetes. By improving insulin sensitivity, fermented foods can help to reduce the risk of insulin resistance and improve blood sugar control. Furthermore, the beneficial compounds produced during the fermentation process can also help to reduce inflammation in the body, which is a common complication of diabetes. Chronic inflammation has been linked to insulin resistance and poor blood sugar control, so reducing inflammation can help to improve insulin sensitivity and reduce the risk of complications associated with diabetes. In summary, consuming fermented foods can be a useful dietary strategy for improving insulin sensitivity in people with diabetes. However, it is important to note that fermented foods should not replace other aspects of diabetes management, such as medication and regular exercise. If you have diabetes, it is always best to consult with a healthcare professional before making any significant changes to your diet or diabetes management plan. 3. Lower risk of obesity. Eating fermented foods has been associated with a lower risk of obesity, which can help to reduce the risk of developing type 2 diabetes. Obesity is a major risk factor for type 2 diabetes, as excess body fat can lead to insulin resistance and poor blood sugar control. Fermented foods can help to reduce the risk of obesity in several ways. First, the beneficial bacteria present in fermented foods can improve gut health and digestion, which can help to promote a healthy metabolism and reduce the risk of weight gain. Studies have shown that people who consume fermented foods regularly have a lower body mass index, BMI, and a lower risk of obesity compared to those who do not consume fermented foods. Second, fermented foods are often low in calories and high in fiber, which can help to promote feelings of fullness and reduce overall calorie intake. For example, sauerkraut and kimchi are both low in calories but high in fiber, making them a healthy addition to meals for people who are trying to lose weight. Third, fermented foods can also help to regulate the hormones that control appetite and metabolism. Research has shown that the gut microbiome plays an important role in regulating these hormones, and consuming fermented foods can help to improve the balance of bacteria in the gut, which can in turn improve the regulation of these hormones. In summary, consuming fermented foods can be a beneficial dietary strategy for reducing the risk of obesity and improving overall health. However, it is important to note that fermented foods should not replace other aspects of diabetes management, such as medication and regular exercise. If you have diabetes or are at risk of developing diabetes, it is always best to consult with a healthcare professional before making any significant changes to your diet or diabetes management plan. 4. Improved gut health. Fermented foods contain beneficial bacteria that can help to improve gut health, which is important for people with diabetes who are at an increased risk of digestive problems. The fermentation process involved in making fermented foods, such as yogurt, kefir, kimchi, and sauerkraut, creates an environment where beneficial bacteria can thrive. These bacteria are known as probiotics and are essential for maintaining a healthy gut microbiome, which can help to improve digestion and overall health. For people with diabetes, maintaining a healthy gut microbiome is particularly important, as the condition can increase the risk of digestive problems such as gastroparesis and diarrhea. Gastroparesis is a condition in which the stomach takes longer than normal to empty its contents, while diarrhea is characterized by loose, watery stools. Research has shown that consuming fermented foods can help to improve gut health and reduce the risk of these digestive problems. Probiotics can help to regulate the balance of bacteria in the gut, which can in turn improve digestion and reduce the risk of inflammation and other digestive problems. In addition, improving gut health can also help to reduce the risk of other complications associated with diabetes, such as cardiovascular disease and kidney disease. This is because the gut microbiome plays an important role in regulating the immune system and reducing inflammation throughout the body. In summary, consuming fermented foods can be a beneficial dietary strategy for improving gut health in people with diabetes. However, it is important to note that fermented foods should not replace other aspects of diabetes management, such as medication and regular exercise. If you have diabetes or are at risk of developing diabetes, it is always best to consult with a healthcare professional before making any significant changes to your diet or diabetes management plan. 5. Reduced inflammation. Inflammation is a common problem in people with diabetes, and it can contribute to the development of complications such as heart disease and nerve damage. However, consuming fermented foods may help to reduce inflammation and protect against these complications. Fermented foods contain beneficial bacteria, such as lactobacillus and bifidobacterium, which have been shown to have anti-inflammatory effects in the body. These bacteria can help to reduce the production of inflammatory chemicals in the gut and improve the balance of bacteria in the gut microbiome. In addition, some fermented foods also contain compounds that have been shown to have anti-inflammatory effects. For example, fermented soy products, such as miso and tempeh, contain isoflavones, which are compounds that have been shown to have anti-inflammatory effects and may help to reduce the risk of complications associated with diabetes. Reducing inflammation in the body is important for people with diabetes, as chronic inflammation can contribute to insulin resistance, which can lead to poor blood sugar control and an increased risk of complications. In summary, consuming fermented foods may help to reduce inflammation in the body and protect against complications associated with diabetes. However, it is important to note that fermented foods should not replace other aspects of diabetes management, such as medication and regular exercise. If you have diabetes or are at risk of developing diabetes, it is always best to consult with a healthcare professional before making any significant changes to your diet or diabetes management plan. 6. Lower cholesterol levels. High cholesterol levels are a risk factor for developing heart disease, which is a common complication of diabetes. However, consuming fermented foods may help to lower cholesterol levels and reduce the risk of heart disease in people with diabetes. Fermented foods, such as yogurt and kefir, contain beneficial bacteria that have been shown to have cholesterol-lowering effects. These bacteria can help to reduce the absorption of cholesterol from the gut and promote its excretion, leading to lower levels of cholesterol in the blood. In addition, some fermented foods also contain compounds that have been shown to have cholesterol-lowering effects. For example, fermented soy products, such as tempeh and natto, contain compounds called isoflavones that have been shown to lower LDL, bad cholesterol levels in the blood. Lowering cholesterol levels in the blood is important for people with diabetes, as it can reduce the risk of developing heart disease, which is a major complication of the condition. Heart disease is a leading cause of death among people with diabetes, so managing cholesterol levels is an important part of diabetes management. In summary, consuming fermented foods may help to lower cholesterol levels and reduce the risk of heart disease in people with diabetes. However, it is important to note that fermented foods should not replace other aspects of diabetes management, such as medication and regular exercise. If you have diabetes or are at risk of developing diabetes, it is always best to consult with a healthcare professional before making any significant changes to your diet or diabetes management plan. In conclusion, fermented foods can be a valuable addition to a diabetes management plan. From improving blood sugar control and insulin sensitivity to reducing inflammation and lowering cholesterol levels, the benefits of fermented foods are numerous. However, it is essential to remember that fermented foods should not replace other aspects of diabetes management, such as medication and regular exercise. It is always best to consult with a healthcare professional before making any significant changes to your diet or diabetes management plan. We hope that you found this video informative and helpful. If you enjoyed this content, please like and share this video, and consider subscribing to our channel for more informative and engaging videos on health and well-being. Thank you for watching.